Hello everyone, today we are talking about mebendazole, the most important and helminthic drug. So nematodes, also known as roundworm, present in gut that can create a lot of problems in your gut. So we have to remove these worms from the gut of the human. So how? We have a lot of drugs to remove or to kill these worms. So one of them is the mebendazole. Mebendazole present in the market with several names like Wormox and M-Worm. And the most important compound present in the mebendazole is the benzimidazole. So benzimidazole is a compound present in the mebendazole, and it is used against a lot of different worms. First is the whipworm, also known as trichura. Second is the pinworm, that is Enterobiasis vermicularis. Third is the hookworm, Nicator americanus. And the fourth one is the roundworm, that is Ascariasis lumbricoides. So this drug is used against all these types of the worms that can be present in the gut of the human. So we will see what will be the mechanism of the mebendazole to kill these worms. So if you see, this is the worm, and as we know, it's a multicellular made up of multiple cells. In the cells of the worms, you see the microtubules. That is the most important component, microtubule. Mebendazole attack on the beta subunit of the microtubule, that is beta tubulin. It's actually a protein that makes microtubules. Whenever, or you can say when someone takes the mebendazole, it binds with the beta tubulin of the microtubules. When the mebendazole binds to the beta subunit of the microtubules, it inhibits the formations of the microtubules. And what will you see in that case when the microtubules polymerization is inhibited by this drug? You will see first cell shape will be disturbed in that case. That is the first most important thing. Second is the reduced in the or the disturbance in the intracellular supports, because microtubules supports the cells of these worms. Whenever there is a disturbance in the microtubules, you will see the intracellular parts of these worms cells will be disturbed in that case. And third is the cell division will also be disturbed in that case. And lastly, most important, that is glucose uptake in the cells of the nematodes is also be disturbed in that case, because glucose uptake is done or having some influence of the microtubules in the uptaking of glucose inside the cells of the nematodes. Whenever you see the disturbance in the formations of the microtubules, it means that glucose uptake will also be reduced, and ultimately you will see the reductions in the ATP formation inside the body of the worm. And after the reductions of the ATP, you will see the reduced energy, depletions of the energy, and ultimately the worms start dying. And these worms can expel from the body, or you can say from the gut of the human body. So these worms, if I say, survives in the gut of the human, and when someone takes the mebendazole, these worms will die, and expelled through the feces of the human. So that is the important thing about the mebendazole, how this mebendazole acts on the worms and kill worms by attaching the beta tubulin of the microtubule. And what will be the adverse effects of the mebendazole in that case? You will see abdominal pain, and you can also see the diarrhea and the nausea by taking the mebendazole. And the contraindication, most important, it will not be used in the pregnancy, specifically in the first trimester of the pregnancy. And if we see the scenario, you see a 7-year-old boy. That is the most important or the interesting scenario that is related to the drug that we have discussed right now. A 7-year-old boy presents to the clinic with nighttime perianal itching around the anus area, and occasional abdominal discomfort for the past 2 weeks. This happening for the past 2 weeks. On examination, small white thread-like worms are seen around the anus of the patient, and his growth and the vitals are normal. So it goes towards the enterobiasis vermicularis, also known as pinworm, that causes itching around the anal area of the 7-year-old boy. And the most important drug that is related to this worm is the mebendazole. So this is all about the mebendazole. If you still have any question, you may ask in the comment section. Thank you so much.